primary focus of my practice is dealing with trauma. Trauma is simply when experiences overwhelm us, and the learning that comes out of that, that fear is residual, and it gets in the way of our functioning, of our noticing happiness, being able to experience pleasure in life, and sometimes we have like sort of intrusive anxiousness, even if it's generalized, we're not even sure why we're anxious. In any case, this kind of anxiety, this kind of trauma and the treatment of trauma has been researched a lot, and a number of best practices are very well understood by clinicians who work to maintain expertise in the practice of treating trauma. Probably the most fundamental building block as a best practice and as moving through this trauma experience, where we don't push it down, but we begin to experience a sense of groundedness. We don't feel as pushed around by the feelings that we might have, and we notice pleasure more in life, is what we call exposure therapy. And exposure therapies are simply where a therapist builds a good rapport, asks you a series of sort of Socratic questions where they may ask you about a memory you have. The therapist should be attuned and go at your own speed. Some people can go right at this stuff. Other people, I've seen people for a year who could talk for initially just a few minutes about a trauma in each session. When we relive experiences, we re-expose ourselves to these memories. We begin to piece those memories back together. We are experiencing and dealing with that trauma in a way where we can learn to cope and go on.